In the TV this morning, they said they got vaccine for the virus now.
Yes, I knew that, and I knew it. They said...
At last, a vaccine is approved that'll soon protect people like 94-year-old Kathy and the carers who look after her. Though Kathy had like her kids to get it first.
I'm had my life. I don't worry about myself. Because if they said, would you have it or you prefer your family, I'd prefer my family to have it.
Drug firm Pfizer's production line is now working at full pelt after the UK's medicines regulator became the first in the world to give this vaccine the thumbs up. The speed of that decision only possible because for months the MHRA has kept up a constant rolling review of the jab's safety and effectiveness.
This vaccine has only been approved because those strict tests have been done and complied with. And everyone can be absolutely confident that no corners whatsoever have been cut.
With the first consignment of 800,000 doses getting packed into these special cool boxes, the vaccine can now be shipped to the UK at the -70 Celsius required to keep it stable. The national rollout will be an enormous logistical challenge. Once supplies from Pfizer's factory in Belgium have crossed the Channel, they'll be distributed to more than 50 vaccination hubs based at large hospitals, with the shipping boxes designed to stay frozen for 10 days while in transit. Once a box reaches a hospital, the 1,000 vaccine doses inside can only be distributed once they've been defrosted to fridge temperature, with a window of just 5 days to inject them all before the ingredients spoil. So although elderly care home residents like Kathy are top of the vaccine priority list, at first it'll be care home staff and NHS workers who'll be called in to the hospital hubs to get it. It's NHS staff who will deliver the jabs too, and today hospital chiefs called on the government to spell out to the public that other healthcare services will inevitably suffer.
A workforce that is already in short supply is being spread even more thinly. Obviously really important that we support the vaccination programme, really important that we manage patients with COVID, really important that we manage winter, and really important that we try and maintain all our other services as well. But there are going to be some choices and trade-offs in the coming months because of that.
But those in the health service also know this final push in the coming months will be worth the effort, as it is vaccines that have the power to end the terrible toll coronavirus takes.
Kathy, massive news this, but some people do have concerns about the possible side effects of the vaccine. Do they need to be worried?
Well, remember, 44,000 people have been part of the global trials of this, and so we're not in the dark about the side effects. You'll get that familiar swollen and sore arm, for example, and around 1 in 50 people reported a high fever or a headache. Around 1 in 25 reported fatigue. So all those reactions didn't last long, and interestingly, older people were less affected than younger ones.
And this is the fastest development of a vaccine ever, isn't it? Regulators keen to stress it is safe.
Yes, I mean, 10 months' work instead of 10 years. It's pretty unprecedented. But usually vaccine scientists spend years trying to get drug firms interested in their research. That delay just didn't happen. Equally, drug firms usually stop after every stage to decide if it's worth their while continuing. Again, no issue this time. Finally, for COVID vaccines, the regulators have cleared their desks, and unusually, they could pore over every scrap of data as soon as they got it. That's the final reason they were ready to make this announcement today.